Now, there's something about the treatment of diabetes that is very effective, but you won't hear about it from most doctors. So that's what I want to tell you today. By the way, I'm Dr. Sai, a medical doctor and the principal tutor of Dr. Sai Physiology Academy, DOPA for short. Welcome to Dopatonic, where we democratize medical knowledge, making it easy even for a 10-year-old to understand, so you can take better charge of your body and health. Now let's get started. So we've done the part 1 of diabetes, okay? Everything about diabetes, the 4 must know facts. And you know that diabetes mellitus, is basically a toxicity of glucose toxicity, which we call hyperglycemia. Glucose levels are so high that it's now causing a lot of problems called metabolic problems. But not only the fact that glucose is very high, insulin is also high. Remember that we are dealing with type 2. The type 1, there is nothing you can do. You have to just replace insulin. The cells that produce insulin are gone, totally gone, dead, because of an autoimmune disease, okay? So 95% of diabetes you see is type 2. So we are dealing with type 2. Just keep that at the back of your mind, okay? So the body is still producing insulin, but there's insulin resistance, all right? So that's why glucose is going high. Insulin takes glucose into the cells, but the cells are not responding to insulin, just as a form of recap. All right, so glucose is the problem, high glucose. But look at this now. You know, glucose is the simplest form of carbohydrates. Okay, there are 3 major types of food: carbohydrate, fats, and proteins. Okay, so glucose is from carbohydrate, then fatty acid is the simplest form of fats, and then amino acids, the simplest form of proteins. Now look at this now. The body needs some amino acid that they call essential amino acids. The body also needs fatty acids that we call essential fatty acids. What do we mean by this essential stuff? It means that the body needs those nutrients, but the body cannot manufacture it by itself. It must be taken from the diet. Are you getting it now? It has to be taken from the diet. But the one of carbohydrate, which is glucose, there is nothing like essential glucose that you must take this particular glucose from the diet as carbohydrate. There's nothing like that. And interestingly, the body can convert protein to glucose, fat to glucose. In fact, the body stores excess glucose as fat in the body. When you take a lot of carbohydrates, you grow fat, because insulin is the hormone of abundance. When there's excess glucose, it now stores it as fat. So it can also convert that fat back to glucose. It converts protein, can also convert protein to glucose. So what do I mean by all of this? It means that you actually can do without taking much of carbohydrates in your diet. Do you understand that now? And it is carbohydrate that is the number 1 culprit that shoots up your glucose very high. Proteins also shoot it up. So if you've enjoyed this content so far, I want you to click the like button and also the subscribe button. Don't forget to turn on notifications so you don't miss any new content that we share. We're going to be sharing content like this every weekend. So tell your friends, share it to your friends, so that it can also help them. All right? Now, there's a study. Studies have shown that when you take in carbohydrate diet, your glucose level shoots very high, insulin level shoots very high. Okay, when you take in pure protein diet, the glucose shoots moderately. Okay, insulin also moderately. But when you take pure fatty foods, glucose does not shoot up at all. It's almost like a flat line. If you look at the graph, almost a flat line. Insulin does not shoot up. So we now recognize that actually we can remove carbohydrate a lot from the diet, if we remove carbohydrates a lot from the diet and take little protein, because you know we need essential amino acids, so we must take proteins, okay? Then now take diet that is very high in fats. What happens? Your blood glucose levels will not rise. And that is the problem of diabetes. High levels of glucose in the blood. Do you understand that now? So you take a diet that has something like 70% fats, 20% protein, then about 10 or less than 10% carbohydrates. You will not have any problem at all with your blood glucose level. You can stay off drugs completely. Not only will it solve the hyperglycemia, which is diabetes, it will also reduce your weight loss. This diet is what most of you might have heard of. It's called ketogenic diet, okay, or keto for short. Keto diet, high fat, little protein, and very little carbohydrates. Now, I can't begin to go into details of the kinds of foods that you should take and all of that, okay? That's the job of the dietitian and nutritionists and people who are keto experts, okay? But that is what solves it. It solves those two problems. Your weight, because a lot of people that have type 2 diabetes, they are obese or overweight. It reduces your weight very effectively and directly reduces your blood sugar. Your blood sugar does not shoot up. And it has solved that problem. Very effective in controlling. In fact, it reverses diabetes. You no longer need any drug for your blood sugar levels to be properly controlled with keto diet. It's as simple as that. It's not more than that. It's not more than that. So take it as an experiment. If you are diabetic, type 2 diabetes, do it as an experiment. Okay, you know, you usually check your fasting blood sugar and all of that and you see what it is. Do keto diet for some days and start checking your blood. You'll see how it has normalized without drugs, without insulin, without tablets, nothing. Your blood glucose level is gonna be controlled. Okay, so this dieting, high fat, low protein, and very low carbohydrates, solves this problem for people. Do you understand that now? All right, so I'm going to see you in the next video.